Okay, so today we're discussing an important research article titled Effectiveness of REBT Group Counseling with Reframing Techniques to Reduce Academic Stress in High School Students. This study was conducted by researchers Shafa Malani, Widya Malsari, and Irene Maya Simon at the Universitas Negeri Malang in Indonesia. Their work highlights how rational emotive behavior therapy, REBT, specifically through the cognitive reframing technique, can be effectively used in group counseling settings to help high school students manage and reduce academic related stress. So we'll delve into how the intervention was structured, its outcomes, implications, and how these findings can inform your own counseling practice with adolescents groups or whomever. I'm going to then segue into a larger conversation about this in group counseling. So, academic stress involves negative reactions students experience due to various school demands, and common stressors include heavy workloads, complex tasks, tests, choosing academic paths, and performance pressures from peers, teachers, and family. These stressors trigger emotional, physical, cognitive, and behavioral responses that can significantly affect students' mental health and academic performance. The shift from online back to traditional classroom settings created additional stress for students who struggled with assignments, grades, and adapting to classroom dynamics. Severe academic stress can harm students academically, emotionally, and socially, increasing risks for serious mental health issues, including depression and even suicidal ideation. REBT is a counseling approach developed by Albert Ellis, focusing on changing irrational beliefs to alleviate distress. Reframing, which is a central cognitive strategy within REBT, involves shifting a client's perception of negative experiences into more manageable, positive views. So, this approach supports students in reframing stressful academic tasks as opportunities or manageable challenges. Again, from the study. The researchers conducted a quantitative study using a one group pre test, post test experimental design. Participants included 6 high school students exhibiting significant academic stress. Researchers used the academic stress scale, validated through rigorous expert assessment, to measure stress levels before and after the REBT intervention. The intervention, as I mentioned, was relative. Well, I didn't mention, but we infer it is relatively small, and it consisted of 6 group counseling sessions. Students were introduced to the ABC model, activating events, beliefs, consequences, and taught to identify their stressful perceptions. They explored alternative positive perspectives, practicing modifying negative thoughts and group exercises, applied these skills through real life homework assignments, and finally evaluated progress during termination. Pre and post test comparisons revealed significant stress reductions in all 6 participants. One student's stress level dropped dramatically from high to low, indicating strong individual coping skills. The other 5 students moved from high to average stress levels, demonstrating meaningful improvement. So, statistical analysis confirmed the effectiveness of the intervention, strongly supporting REBT and reframing techniques. The effectiveness lies in how students learned to identify and challenge their irrational thoughts. Reframing techniques enabled students to view academic stressors in a new, manageable way. Increased self confidence and assertive communication empowered them to handle academic pressures better, substantially reducing their stress. This study provides practical implications, highlighting that school counselors and mental health professionals can effectively integrate REBT reframing techniques into group counseling in this case to manage academic stress. It also suggests opportunities for future research, including controlled comparisons or applying techniques to different student populations, certainly larger populations. So as I keep restating, a limitation was the small sample size and the absence of a control group, restricting broader applicability. Future studies should include larger, diverse samples and controlled experimental designs to test long-term effectiveness across varied academic environments. So, in conclusion, this research demonstrated REBT group counseling with reframing techniques effectively reduced high school students' academic stress. These findings emphasize cognitive restructuring's critical role and affirm evidence based group interventions as practical tools for school counselors addressing student mental health. So now I want to transition a little bit more generally because I'm a little school specific, but I did want to have a school specific example because we do have people here who are studying school counseling. Um, so as I mentioned before, rational emotive behavior therapy was developed by psychologist Albert Ellis, and it's a foundational cognitive behavioral approach used widely in counseling settings. For all of us, I think REBT provides a clear structure for helping clients identify irrational beliefs that contribute to emotional distress, relationship conflicts, and dysfunctional behaviors. In REBT, it's critical for counselors, therapists to guide clients in recognizing that emotional disturbances are not directly caused by life events, um, but by irrational beliefs about these events, which then produce negative consequences. This model will be particularly valuable in your future roles, enabling you to intervene effectively at the cognitive level. In group counseling, REBT becomes especially powerful by normalizing experiences. As future therapists working with whomever, couples, families, or groups, you'll observe that members often share common irrational beliefs. Group interventions encourage peer learning, empathy, and support, crucial skills in helping clients restructure their thought patterns, enhancing relational dynamics. As therapists, using cognitive disputation within groups allows clients to experience direct feedback on their irrational beliefs. Reframing can help couples or families alter negative perspectives, transforming conflicts into opportunities for emotional intimacy and growth. Assigning practical behavior based homework encourages clients to apply new skills at home, reinforcing change. And role playing provides clients safe practice space, enhancing confidence and relational skills. Group counseling using REBT is resource effective since multiple students, in this case in schools, right, are supported simultaneously. It reduces isolation, showing students they're not alone in experiencing stress. The group context encourages active learning and personal responsibility as students learn from and support each other, which strengthens personal empowerment. For future mental health counselors and marriage and family therapists, I think utilizing REBT and group counseling offers significant benefits. It can effectively address relational difficulties, improving communication boundaries and conflict resolution. The group context encourages mutual accountability, and as counselors, you can directly observe, intervene, and modify maladaptive relational patterns. Additionally, groups empower clients as they actively build healthier cognitive patterns together. When implementing REBT group counseling, establishing clear group norms about confidentiality and respectful interactions is crucial, as it is with all groups. Your role as the counselor involves guiding discussions, maintaining group structure, and modeling cognitive techniques. It's essential to ensure that techniques are developmentally suitable, and if we're talking about adolescents, in schools or whatever level we're talking about in schools, I'll say adolescents require sensitivity when their core beliefs are challenged. So regular assessments ensure the approach remains effective and appropriate for students. When employing RBT groups clinically, clear guidelines around the same issues. Confidentiality, boundaries, and respectful interaction are also vital. You want to adapt cognitive interventions carefully to your client's developmental and relational context. What's appropriate for one group may differ from a couple's counseling session. Remember, your role as facilitator is proactive, intervene compassionately, model empathy, and manage harmful dynamics promptly. Continual evaluation ensures the group remains therapeutic and goal focused. Within marriage and family therapy, I think REBT is highly effective. So, for couples challenging irrational beliefs about relationships, such as the unrealistic expectation of constant agreement, can drastically improve relational health. Families often benefit by restructuring irrational beliefs around roles and responsibilities, promoting healthier interactions. And furthermore, REBT assists clients in managing emotional reactivity during relational stress, fostering more constructive conflict resolution. So, in conclusion, REBT offers you, as future therapists, counselors, etc., robust tools for facilitating cognitive and behavioral change. It's structured, clearly defined approach, enables effective intervention across various clinical scenarios, and I think it's particularly valuable for relational and group counseling. Um, Utilizing REBT, you'll empower clients toward lasting emotional well-being and healthier relational dynamics. So to further enhance your knowledge and clinical skills in REBT, I recommend several professional resources. The Albert Ellis Institute provides structured training and certification in REBT at primary and advanced levels. This is something I had an opportunity to participate in many years ago. I thought it was very good. Additionally, the Beck Institute offers excellent training in cognitive behavioral techniques relevant to your practice. And of course, various professional organizations offer valuable ongoing resources, continuing education, networking, and ethical guidance. So I encourage you to pursue certifications if so interested, to solidify your professional credibility, and finally consider incorporating some of these recommended texts into your professional library, which will provide deeper insight and practical skills to support your future practice.